A tilt-in-space wheelchair is a specialized wheelchair where the entire seat and backrest tilt backwards together as a unit, allowing the seat angle to change while keeping the hip and knee angles the same. These chairs are typically for people who need external support to sit upright, pressure relief, or caregiver-assisted mobility. A tilt-in-space chair helps caregivers reposition the user safely, reducing the risk of pressure injuries and other health risks. Tilt helps maintain upright posture and accommodates a posterior pelvic tilt, kyphosis or lateral trunk lean from scoliosis, enhancing comfort for those with decreased strength or endurance. Tilt also reorients the body, helps open up the chest, improves the field of vision, and supports a more neutral, functional posture. Pressure relief is crucial in helping to avoid pressure sores, skin breakdown, ulcers, restoring blood flow, preventing tissue damage, and promoting healing. If a user is unable to shift their weight on their own, research has shown that to avoid skin breakdown or pressure sores, the users should be tilted back for at least 3 minutes at a time every 30 minutes when seated in the chair. A tilt of 65 degrees or more offers significant pressure relief. A tilt of 30 degrees or more relieves some pressure, and a tilt of 15 degrees or less offers no pressure relief. Consistent position changes are critical in order to avoid added pressure to different parts of the body. Depending on the user's needs, there are several types of supports that may be present to help them maintain body position, prevent injuries, and ensure comfort. Lateral supports keep the trunk centered and prevent leaning to one side. A headrest keeps the head and neck in a comfortable, neutral, midline position. Hip guides prevent the thighs from drifting outwards. Foot supports, such as toe straps, ankle huggers, or calf straps, may be used to ensure the feet remain in a safe, supported position on the foot plates. Anterior trunk supports, also known as chest harnesses, help keep the trunk in between the laterals to help maintain a neutral trunk alignment. A pommel, or medial abductor, prevents the knees from touching and creates excess force for individuals who can't reposition their legs independently. A pommel is meant for leg positioning only and is not meant to prevent sliding. If you have concerns about sliding forward in the chair, contact your equipment clinic to discuss alternative positioners. Anti-tips are critical to prevent the chair from tipping upside down due to excess weight or while navigating up and down uneven surfaces. Check the seat position. Hips should be all the way in the back of the seat, spine aligned with the backrest, and knees and ankles supported comfortably with the foot plates at a comfortable height. Typically, there should be 1 to 2 inches of space between the back of the knee and the seat cushion to avoid excess pressure in that area. Check the cushion and posture supports. Make sure the cushion is positioned correctly, and adjust the lateral supports, pelvic belt, or chest straps if the chair has them. After a user is transferred into a wheelchair, it is recommended for the caregiver to go through a checklist. They make sure that the seatbelt is fastened, the user is all the way back in the seat, the seatbelt is tightened, the chair is in a neutral position, and the remaining supports are secure. When ascending a curb, approach straight on. Tilt the chair back and propel the rear wheels up and over the curb. When descending a curb, you may want to go down backward to prevent forward tipping and reduce caregiver strain. When on uneven terrain, tilt the chair slightly backward to use more of the larger back wheels, which will help disperse the weight. When navigating tight spaces, keep the chair in its most upright position and use small turns instead of large round ones. With the right setup and proper use, tilt-in-space wheelchairs make day-to-day dependent mobility safer and more supportive for people who rely on them.